Federal government shutdown just happens to fall right around the same time as the start of flu season.
And it's put a hold on one national program's ability to track flu outbreaks across the country. News 8's Leah Linscheid joins us in the studio with how that's affecting local health officials.
Mike and Lisa, the Center for Disease and Control Prevention is entering its third day of closure because of the government shutdown. Without the CDC, important information isn't getting out to the public. Info like when, where, and what kind of flu strains are breaking out across the country. Those are statistics that are vital to local health officials, especially today when several flu shot clinics are opening. So this week, they're looking elsewhere for that information.
And Larry, have you had the flu vaccine before?
Yes.
It's opening day for flu clinics across the city to start offering vaccines, and Larry Vitsenda's first in line.
So you're going to feel a little poke here, Larry. 1, 2.
His yearly flu shot is all Larry's worried about today. He isn't thinking about the federal government shutdown and its implications for this flu season, but health officials here are.
Infection control isn't an 8 to 5 Monday through Friday job.
For workers at the Center for Disease Control and Prevention, it's not a job at all right now. During the federal shutdown, the center isn't monitoring nationwide outbreak trends, just as flu season kicks in.
Are we starting to see cases of the flu? What types of the flu are circulating? Is this different than it's been any previous year?
This is all vital information to health officials, normally put out by the CDC, that's been put on hold during the shutdown.
A lot of that work isn't happening at the CDC level, but rather it's happening right here at the local and state level.
Regional officials are taking the responsibility to cover any gaps in monitoring caused by the CDC closure. They're keeping tabs on any flu outbreaks in the Midwest, and local hospitals are relying on that data instead.
I've got great relationships with some of the local and state individuals, so those are the relationships you utilize and enhance in a time like this.
How easy was that?
Yeah, did it hurt?
No.
Larry's walking out of the clinic with a fresh Band-Aid and a renewed defense against the flu. And experts here are picking up the CDC's slack and continuing the fight against flu season.
Infectious diseases don't stop because of a time on the clock or because of the CDC being present or not being present.
Flu tracking isn't the only thing being put on hold at the CDC. Other infectious diseases like salmonella or the measles aren't being monitored either. So health experts are also turning to the World Health Organization to follow outbreak trends across the states.
Thanks a lot, Leah. Some of the CDC's longer-term programs are still up and running during the shutdown, including research on AIDS.